are just going to talk about craniosacral therapy real quick and why it's important for your little ones to come in to get it. So
Yes, absolutely.
Go for it.
I was just going to say we do craniosacral therapy with all of our babes who are under 1 year, and then we also do it for all of our new patients. It's a little bit extra for those new patients, get a little extra love to their nervous system, which we'll dive into. And then babes under 1, it's incredible for a lot of things.
Right.
yeah.
Basically supporting the nervous system, but
Shoot.
Thank you, Dr. Mariah. And that is the life of a live video,
Exactly.
right?
And so we'll just kind of dive into like why craniosacral therapy is very important for those little ones, especially like Cassidy said, for the first year of life. And so what craniosacral therapy is basically just working with the sutures of the skull, because as baby comes through that canal, they're kind of getting squished and smushed and everything's overlapping and all the things to make sure that they can fit. And when they come out, they're just kind of like, the bones are finding their way back into their normal place. And so we are there to assist, to allow them to go back into their normal space and allow brain to develop and fully function normally.
Yes. So, kind of to what you mentioned, when they are birthed, their bones overlap. So those bones stay detached, or I guess separated, until your early 20s.
Yeah.
When your little one gets to around 2, you'll stop feeling, soft spots and like true suture lines, but nothing's fully fused until your early 20s.
Yeah.
So it can be a really powerful therapy, especially for our young ones, simply with gentle pressure to guide the bones in the direction, which allows the brain to expand and grow the way it needs to.
Exactly. And one thing that is extremely important with this technique is we're feeling for tension. And so there is fluid in our brains and around a little bit everybody's brain that flows from the brain to the spinal cord, and it pumps about 17 times. It's called cerebrospinal fluid. And so when that fluid gets stuck or sticky, or if there's any tension in and around the skull, it can cause little twinges. I say twinges lightly because it's not an actual twinge, it's tension throughout the body. If that tension, I'll grab the baby doll, can be, if the tension is like lower in their spine where that cerebrospinal fluid can't pump fully, then it can cause like constipation, gassiness, anything that's kind of going on in that lower digestive tract. If it is that little bit of tension that's flowing throughout their spine that causes into the middle of their spine, it can cause things like reflux, diaphragm tightness, any sort of like explosion with puking or anything like that. And so yeah, we just really want to emphasize the importance of this technique, especially for those little ones, because as little ones get older, those symptoms, I like to say, are very common in little ones, but technically they're not normal. And so we just want to really reduce any sort of symptoms that might show up a few weeks after birth, a couple months after birth, anything that kind of like can develop. If that tension gets too much for your little babe, those symptoms might start happening. So
yeah, absolutely. So what it really looks like is just really gentle pressure on the skull. We say it's about the weight of a nickel, the pressure that we're using along those suture lines, and then guiding them, like we mentioned before, in the right direction. And then another thing to mention, kind of like you were talking about with the tension, we can also talk about fascial tension here. So all your muscles are wrapped in this fascia, or it looks like saran wrap, essentially. Saran wrap that's super sticky. And the stickier the saran wrap, right, if it can't glide over those muscles, your muscles can't move the way they're supposed to. Same with nerves. They cannot move, glide, and if they can't do that, they can't communicate with who, what cell, organ, tissue that they need to communicate with. So I feel like that's why the bodywork piece, the piece that we teach you in here, the exercise that we go over, that we give you, are really important with this treatment as well.
yeah. And we can also dive into a little bit about lip and tongue ties as well with little babes with that craniosacral therapy. Because as Cassidy said, there's that direct fascial connection throughout the entire body. There's saran wrap everywhere. Well, research has shown that there is a direct fascial connection to the tongue, to the tip of the toe, and it's goes continuous from the tongue to the diaphragm all the way down. And so let's say that you have a tongue tie and it's super restricted and everything like that. You're refluxy, your tension, you can't relax, you're holding, you're clenching your fists all the time. Well, the craniosacral therapy can also help reduce that tension in and around the mouth as well. So we really want to emphasize that with lip and tongue ties too. So
Yes. So a tongue tie is just when the frenum underneath the tongue, the tissue that attaches the tongue to the base of your mouth, I suppose, is too restricted, too tight, and the tongue lacks mobility.
Yeah.
So it can present with feeding, breastfeeding, latch issues, but as Dr. Jess mentioned, it's connected all the way down into your big toe. For any of the other medical professionals out here, we're talking about your deep front line. So if you Google deep front line, you're going to see an image of all the muscles that are connected in the front line, and that's simply fascial connections. So just kind of cool. If you're holding tension in one spot, it could be because of a restriction elsewhere. And then also important to mention that torticollis, plagiocephaly, those things are really interconnected with tension in the skull, tension in the upper neck and spine, and then even with tongue and lip ties, there's direct connections, so not even just fascial, but direct connection to your anterior neck. So those muscles that are helping control the chin, control your head position, and with lack of head mobility is when we get those flat spots on the skull.
So, we could talk hours for this, but that is our short and sweet
Yes.
explanation of craniosacral therapy, of why it's so important, especially for that first year of life. And then, yeah, anything else that we got?
Gosh, no. I mean, like she said, we could talk about this for hours. So I feel like it's a great stopping point to just cut her off. We might need to do a little bit of a live series with the craniosacral therapy stuff. So have a great Thursday, and we'll be back tomorrow morning for some more live adjusting.
Yeah. Have a great day.